Welcome to another session of Break for Health. Thank you so much for joining us. Today, we're asking the question, are the kids all right? I'm Joan Elder with Community Health Foundation, the host of Break for Health. We received technical assistance for these sessions from Alex Miller of Shiftology. And I'm pleased to welcome back our moderator, Nettie Carter-Smith. She's the Director of Community Relations at Rocking Horse Community Health Center. And we're very lucky to have Nettie with us again. I'd like to give you a few tips about the Zoom webinar controls. If you move your cursor to the bottom of your screen, you'll see a bar similar to the one that you see in this box. The chat function is turned off for this session, but you can ask questions by clicking on the Q&A box. You'll notice that live captions are on, but if you'd rather not see that, you can hide them if you like by clicking on live transcript and then click on hide subtitle. Now I'm going to turn the session over to Nettie, who's going to start things off with an audience poll that we'd love for you to answer while she introduces today's panelists. Take it away, Nettie.
Thank you so much. Hey, everybody. It's Wednesday. It's hump day. It's Wednesday.
Yes.
And we're so excited to be here. Like Joan said, we are asking the question, are the kids all right? We have a fabulous panel of experts that will be able to have this conversation with us. So we're so excited. So let's get into it because we got a lot of information to cover. Alex, can we pull up the first poll question? First round of poll questions. We've got 3. And I'd like for everybody in the audience to take an opportunity to answer those questions. While we're doing that, I'm going to also have the panelists introduce themselves, and they'll also share with you one of their answers of the poll question. Starting us off is the one and only Beth Dixon. Beth?
Hey, Nettie, how are you?
I'm great.
Thank you for having me today, Joan and Nettie. It's good to be here. My name's Beth Dixon, and I am a prevention education coordinator with Wellspring. So my job, I'm a PACS partner, I'm a BOTFIN educator, and what I love most is working with youth. I'm an adult ally for a youth-led prevention group called BATS. BATS stands for Bringing Awareness to Students, and I'm just thrilled to have 2 of our BATS members here today, Monica and Brianna. Oh, and looking at the poll questions, I just would like to share that I had a mostly positive experience in school. I didn't get good grades all the time, but I was involved in a lot of great extracurricular activities. So
Great. Thank you. Monica.
Hey, I'm Monica. I go to Springfield High, and I've loved all my teachers. Seriously, they're all great people.
Okay. Bree.
Hello, I'm Brianna. I attend Springfield High, and in response to my poll question, all my friends I've met in high school have had a great impact on me.
Awesome. Let's keep it going. Sherry?
I'm Sherry Akers. I'm a counselor at Shawnee High School, and I'm an adult ally for our youth program, which is STARS, which starts students to talk about real stuff. And I had a very positive high school education.
Great. Emily.
Hello, everyone. I'm Emily Lawrence, owner and lead instructor with Live, Move, Breathe here in Ohio. I teach mindfulness and movement classes to the preschoolers over at the Champaign County YMCA. And looking at the poll questions, I had a very positive high school experience.
That's great. I can't wait to hear more about the mindfulness with preschoolers. That's great.
Thank you.
Dr. Johnson.
Good afternoon, everybody. My name is Dr. Martin Kyle Johnson. I am the clinical psychologist for Springfield City Schools. Of the many responsibilities that I do have, I lead our trauma-informed care learning community and our district's crisis team. So I'm happy to be here with you all today. And looking at the poll questions, number 2, my teachers had a big impact on me. Yes, at least one, especially the one that chose me to be Martin Luther King in a school play and say that I have a dream speech. So that was
There you
pretty,
go.
that was pretty cool.
Yeah, the name helped too, I'm sure.
Yes, yes.
Right. Okay. Ashley.
Hi, my name is Ashley Wilson. I am the lead nurse at Springfield City Schools and also care for the medically fragile kids. I definitely had a positive experience. I was born and raised in Springfield City Schools, and now I'm fortunate enough to work with them. So I'm very blessed in a lot of aspects.
How awesome is that? That's great. And Patty.
Hello, everyone. My name is Patty Free. I'm the immunization supervisor here at the Clark County Combined Health District. And as far as polls go, my teachers had a huge impact on me. I wanted to be a nurse when I was going through school, and that dream did get to come true.
Great. I'm going to come right back to you, Patty, but let's take a look at the poll responses. Wow, look at that. 95% answered question 1. That was me. 100% for number 2 and 95% for question 3, the first one. Yes, yes, yes. So we're off to a great start. So let's just keep it moving. Patty, talk to us about immunizations and the importance of that. Let's talk about the physical aspect of health.
Okay, so immunizations play a huge role in keeping our youth healthy. We have some immunizations that are required to be in school because we're trying to get that herd immunity and keep vaccine preventable diseases at bay. So every child going to kindergarten have certain requirements they have to meet, same when they get to 7th grade, and again, when they're seniors in high school.
What if a child falls behind on their physicals or immunizations? What should a parent do?
Well, it's never too late to start. So we always recommend that every child gets an annual physical, but if they've fallen behind, we just kind of make a phone call, get restarted again. Same with immunizations. We never restart series of vaccines over again, but we can just start over, not start over, but start where we've left off.
Okay. So how have things been? And I'm actually probably going to open this up to Ashley too. Both of you guys can answer this. How have things been over the last 18 months? Clearly, schools have not operated as they normally would in years past, but with the coronavirus, and now we've got the vaccine. How are things?
Well, I've noticed when I've been out to the schools that there are a lot more parents, especially last year, that because doctors' offices were closed, we didn't have quite the response that we normally do to back to school immunizations. I believe Ashley can probably, agree with that. Our immunization rates are a little farther down than we'd like.
Okay. Ashley, do you want to add to that?
I think with immunizations, a lot of the struggle was that a lot of kids went online last year. And so without being in person, a lot of people took the extra precautions of not going to the doctor's office. I think there was a fear that if they went to the doctor's office, they would spread germs. There's the sick kiddos at the doctor's office being treated for well visits. So I think there was a lot of hesitancy last year. So we really hope to see a rise in that this year as far as people getting up to date and back on track.
That's good. Why are certain immunizations required for school? So I don't know, I'm not the expert, but there are certain immunizations that are required. Can we kind of talk about a few of those and why we want kids vaccinated or immunized for those?
Sure. A lot of our immunizations are series of shots. For example, the DTaP, which is diphtheria, tetanus, and acellular pertussis or whooping cough. We start those out when the kiddos are little, when they're 2 months and 4 months, 6 months old, again a year. And then that protection kind of wanes. So we boost them again when they're in kindergarten. We boost them again when they're in 7th grade so that we kind of keep that protection going on. Other vaccines like hepatitis B or polio, we vaccinate when they're little, make sure they get their booster when they go to kindergarten if they need to. And that provides usually a lifetime of protection. So we do that to, like I said, reduce vaccine preventable diseases, get the herd immunity for those that can't be vaccinated.
Okay. So how often should teens get physicals? Now, I'm going to be honest. Okay, so I was fortunate, I played sports, right? So I guess I would go and get a sort of quasi physical where everybody would go to the high school and line up and a doctor would, just do kind of the basic overview. But I'm thinking teens, that physical probably isn't what we're talking about. So how often should teens get physicals?
Well, teens, along with everybody else, should get an annual physical.
Okay.
It's the best interest. We always look at wellness is prevention. Prevention is key. So it's better to catch something early. And if you have that good rapport with your doctor and you're seeing them every year, then they kind of know what's normal for you and what might be abnormal.
Okay. Good. Thank you. So I guess I've heard conflicting thoughts about vaccinations. What would you tell a parent what to believe or what to follow? What should they do?
Well, I always try to recommend, we get people here that are vaccine hesitant or they only want certain shots. So I have this conversation quite a bit with our parents as they come in. But we always recommend really good resources like the CDC or the American Academy of Pediatrics, just so they have good resources to get the information and the answers to their questions.
Okay. I know that the health department is also a great website or resource for people if they need information. And again, COVID has impacted us for the last 18 months. Can you talk just a little bit about that and where people can go to get information on that?
Sure.
Challenging.
Right. Actually, our website's gonna be doing some updates soon. So currently, if you go to www.ccchd.com, we have some COVID data statistics on our front page. We have some very clickable sections. We have immunization specific section, and it actually currently has each individual disease type of vaccine preventable disease. So they can click on that for more information.
That's good. Thank you. Thank you. Let me transition to just ask a few questions to Ashley. And again, thank you, Patty. But again, feel free to continue our engagement. But just as I mentioned with Patty about the role of the health department, I can't even imagine what the role of nurses is and have been since last year. Can you talk a little bit about your role and what's changed with students, with parents, with just how everything functions and how nurses are able to navigate through that?
So I think nursing in general, we wear many hats. Needless to say, the school nurses the last 18 months have put on many different hats. A big part of our day actually goes to COVID tracing. We do our very best to try to keep the students, families, staff, everybody as safe as possible. So we spend the majority of our time tracing COVID cases and just trying to keep the schools open so we can keep everybody in person and where the best learning is going to take place at. On a normal day, we do everything from daily meds, bumps and bruises, immunization compliance. We have state mandated vision hearing screenings, kids with allergies, diabetes, trachs, tube feeds, caths, you name it, we have it. So we kind of do everything. And then we also try to bring different programs into the district, like Shoes for the Shoeless. We've done hygiene drives, coat drives, coat closets. We refer to all kinds of outside entities to try to get resources that students or families may need. So we do a little bit of everything, I think, but we all love our job. So
yeah, well, that's good. Can you talk a little bit about your the school's COVID protocol and how you guys navigate through that, how that works a little bit?
So currently, we will take all of our advice and guidance from the Clark County Combined Health District. We also work very closely with them girls. We also do a lot of CDC and ODH guidance. So we have a COVID committee that we meet, and we make our guidelines based off the recommendations of those other entities, basically.
Okay, thank you.
Mhm.
How does the school nurse help with programs in the school?
Programming, basically, if you come to us and you ask for help with something, we'll try to make it as safe as possible. We'll try to make sure you have everything you need. And we will basically get volunteers if it takes volunteers. Social distancing, if we're set right now, it's everything is COVID protocol. So are you social distancing? Do you have enough PPE? Are there seating charts so we can do tracing if appropriate? So we're kind of in pandemic mode, which is
We are.
right now, but on a normal basis, even without pandemic mode, any programming that we can help that's going to bring something positive to our district or our kids, I've never had a nurse turn anything down so far.
Okay, that's good. How many nurses do you have for the entire school district?
So I currently have a nurse in every of our elementary buildings, which is new this year. So I'm very excited. So we have 10 elementary school nurses.
Okay,
And then we have a nurse for 2 of the middle schools. We have a full-time nurse at the high school, and then a part-time nurse that goes between half at the high school, and then she comes to the preschool. And then we also partner with the Rocking Horse, and they will be covering our other 2, our middle school and our school-based healthcare, or not school-based healthcare, but SOI, the School of Innovation.
yes, ma'am, we do, and yes, ma'am, we will. How about that?
Yes.
Yes.
So
Great partnership. We've been doing that for
absolutely.
years. Yep,
So our
love it.
team has grown significantly this year, and we are very, very happy about it. And we're able to deliver a more wide range of care and be in the buildings more, and give our families the resources and help they need.
Yeah, that's great.
Yeah.
Can you talk a little bit about, now I'm going to ask this question, but I'm going to ask everybody this question here in a minute, but how does a school nurse work with the kids that have chronic diseases, whether it be diabetes or other physical challenges? What is your role, and how do you help kids navigate during their school day?
So the most important thing is we try to educate them. We try to educate them on the disease process, on their diagnosis, how to become more self-sufficient. We want them to be as independent as possible. So we do a lot of teaching, hands-on training. We work with the doctor's offices. We work with the parents, and we try to make sure that we're all collaborating on the same page. And that way our overall goal is to get that kid as independent and self-sufficient as possible, but also not to make them feel like they're any different than any other child. Just because a kid has diabetes, or just because a kid may need CAP, they still have the right to an education just like every other child. And we try to make them feel as though they are included just as every other kid would be.
Okay, that's good. That's helpful. What health resources are being brought to the students in school? Are there other health resources? Can you talk a little bit about that?
So we have, we work closely with all the local doctor's offices. We also work with Dayton, Columbus, and Cincinnati Children's. So we can do a lot of calls to refer for other services. We have a dental clinic that's actually coming in. It's a mobile dental clinic with Western Health Partners of Ohio, and they'll be visiting every one of our schools for a full week this year.
Wow.
We also have them partnering with the preschool, and they come in and do immunizations and wellness screenings for our preschool kiddos. We also have set up some vaccine clinics at the high school a few times for staff and students to give our athletes an extra opportunity, and just our high schoolers who are 12 and older, in order to get the vaccine.
So that's the COVID vaccine?
Yes.
Okay. Have you guys done any flu vaccine clinics, or is that something that you're thinking about doing? Or
So we have not partnered as far as with the health department for the students to get the vaccines. They usually get those at their doctor's office, but
Gotcha.
we do partner with Carson's Pharmacy, and they do give our staff their vaccines.
Oh, okay. Yeah, that's nice.
Yeah.
That's nice. How can members of our community, somebody have a question or comment? I thought I heard something. Was that me? Maybe not. Okay. So how can members of the community help meet kids' physical needs? How can we, it takes a village. So how can we wrap our hands around kids and help support them?
So make sure they have what they need. Make sure that the kiddos are getting enough sleep. Make sure that they're doing their homework. Make sure they have a quiet place to do their studies. Make sure that they are getting their annual well checks, that they're going to the dentist, they're getting their eyes checked. If a kid can't see and they're in the back of the classroom because the teacher doesn't know that they have vision problems and then they're doing horrible in school, it's probably because they can't see the board and they're afraid to say anything. Could you imagine sitting in class all day having a terrible toothache or a hole in your tooth and sitting through that pain? So it just keep it up on the daily health maintenance of any child is so important. A healthy kid will always learn better.
Absolutely. Yeah, that's true. Well, you just segued into my question that I really wanted to open up to the entire panel. We kind of talked about this a little bit before we got on, and there was a question that Joan received. I think it was a parent that asked, I think she has a sixth grader. Is that right, Joan?
Yes, I think it was a sixth grader. And it's a great question for every age group. So
yes, for every age group. So I'm going to ask this question. How much sleep should kids get at different ages? So we have seniors in the building. Emily is working with preschoolers. We've got Patty and Ashley and Dr. Johnson that work with kids of all different grades and ages. How much sleep? How much sleep should a kid get? There's no, I don't know if there's a right or wrong answer or not. I'm not sure, but let's talk about it. Let's talk about it.
There's different age ranges and there's different recommendations. So as a child that's smaller, and correct me if I'm wrong, I believe it's 10 to 12 hours, maybe 10 to 13 hours, and that's ages 5 and under. Wow. And then as you progressively get older, I think once you hit 18, it's at least recommended 7 hours a night, and that's all the way through age 60.
Okay.
The CDC provides recommendations, and Ashley hit the nail on the head. For 5 and under, it's roughly 10 to 13 hours, and then you look at that age range between 6 and 12. You're continuing to talk about 9 to 10 hours of sleep. And again, as you get progressively older, the CDC suggests for that teen level, 8 to 10 hours. And then 18 to 60, they suggest at least 7 hours as a baseline. I know, and for psychologists, we could stand to get a little bit more than that.
Right. I'm trying to go back to preschoolers for me.
Yes,
I mean,
right.
That's me. Beth?
Well, I guess what I have to contribute to this conversation is I think a lot of kids are sleeping with their cell phones. And so it's in their beds with them. And so I'm going to turn it over to Monica and Brianna. I don't know if they would tell us, are you getting that much sleep? 7 hours of sleep at least a night? Or do you sleep with your cell phone?
I am not. Nope, not even close. Not at all. No.
Wow. So how many hours would you say? I mean, how many hours of sleep?
I think I'll say 5 to 6. It really just depends on where I end my homework at.
Yep.
I was just about to say, you're up doing homework, right?
Yes.
Okay. You both get gold stars. Yeah. Emily, Sherry, you want to comment? Want to engage? What do you think?
Yeah. So go ahead, Sherry. Go ahead.
Now, I work with high schoolers, and I agree with Monica, Brianna, and with Beth. The cell phones and all the demands that they have do prevent them from sleeping.
And for the younger age groups, sometimes it's harder to get those extra hours in, especially if the children are used to, just the combined bedtimes if there's varying ages throughout the home. But yeah, trying to make that additional effort to make sure that they get the sleep that they need, because at the really young ages, the 5 and below, the big emotional meltdowns, the tantrums, for children that don't have their needs met, and it can be any physical need, either, their need for their attention, their need for food, their need for sleep. If any of those needs aren't met, then it's so much easier for them to project those things out because they don't have the internal coping skills that a lot of older children and adults have. So yeah, just trying to make that a priority can really help some of those emotional outbursts because they'll be better equipped to deal with them.
Thank you. We had a question come in, and I'm going to pose this to the panel. Anthony asked, how do you feel the COVID-19 pandemic will or has changed health programs, systems within schools going forward, even past the pandemic?
I would have to say that I think that with the pandemic currently going on, even past it, it has shed a light on the importance of health and how important it is for kids to be healthy while they're learning, while they're in school. I think it's really on the bright side, or looking at the glass half full, there has been a light shed on the importance of healthcare in one way or another.
I want to piggyback off Ashley's point. I think one of the things that the pandemic has done, at least from the perspective of a psychologist or a mental health professional in the schools, is sort of emphasizing the importance of supporting social emotional well-being, and the role that the school can play in providing that structure, consistency, pattern, repetitive experiences where kids benefit from and being in that sort of socialization space. So I know, at least from Springfield City's perspective, we've increased or enhanced our focus on how do we not only support the social emotional needs of students, but our staff and their overall well-being as well.
Okay. We've got another question and a comment, and I want to, I will ask the question once we finish the second poll, our second round of polls, but I'm going to read this comment while we're answering the poll question. So can we go ahead and start the second round of the polls? We got poll number 2. We've got a couple questions that we want to ask. We'd like the audience to please answer those. And again, please continue to make comments and bring your questions, because it's a really good conversation, and it's good to have that interaction so we can get your questions answered. So I think we're ready for the poll questions. Poll number 2.
I think Alex is having, our techie's having a technical problem.
Oh, okay.
So
Well, Alex is figuring that out. I wanted to respond to what schools are doing in response to COVID. And, being in the schools, I think that I'm amazed at our resiliency as a community, as schools, when I see hand sanitizer as you walk in the building and extra masks and stickers on the floors and all that schools and teachers and administrators are doing to protect our students amid all of this. And so one of the things I guess I've learned just, in my position is how resilient we are and how ready to respond we are. And that's been just positive for me.
Yeah, that's good. Let me read this comment. It was submitted by Anita Biles. And she says, I think there's an assumption that COVID is going to end relatively soon. And when that doesn't happen, classroom staff become disheartened, frustrated, and scared. We support classroom staff mentality through this pandemic while still providing services. Absolutely, which I think is great, which is what we need to continue to do. It's just like you said, Beth, we continue to find ways to navigate through and be resilient. I mean, no one has seen this. This is a new normal for everyone, but we are getting through this, which is a great thing. Let me slide to the next question. Natalie Huber asked a question, and I'm going to open this up to everyone. We're still working on the poll questions, so just bear with us. We'll get through this. But Natalie asked, does anyone address natural circadian rhythms, sleep timers, and schedules with kids or families? teen sleep cycles are significantly different than preschool. Anyone care to comment?
I think some of the schools from just historically, my husband is a teacher, they're trying to do some slightly different schedules with having some of the high schools start later where they used to start first because of the sleep patterns and circadian rhythms of children and how they stay up later. So I know that's one of the things that they've been trying to do, but I don't know that they can address it fully on each individual level.
Okay. We're back. We're working on the poll questions. Okay, poll number 2. What percentage of youth report that they drink alcohol? You've got a few choices. What percentage of youth say that they've used illegal drugs? And what's the biggest concern for today's youth? So we'll give the audience an opportunity to answer those questions. And I'm going to ask Sherry, what do you think the percentage of youth report that they drink alcohol? What percentage do you think that is?
Well, I guess I would need to define youth, because at the high school, in the middle school, they're more likely to, I would say they're 11 to 30% would say that.
Okay. Emily, what do you think about question 2? Excuse me. What percentage of youth say that they've used illegal drugs?
So for that, I am guesstimating that it would be more or less a middle ground. So maybe some have been exposed to or had the opportunity to try. I know that, with social distancing and the closing down of a lot of outlets, perhaps something like this might even be higher because of the pandemic, because they don't have the activities available to them that would otherwise be.
Okay.
So that's my guesstimate.
Okay. And Dr. Johnson, you'll take the last one. What's your biggest concern for today's youth?
So my biggest concern for today's youth is the increase of behavioral and mental health issues over the past 10 to 15 years. I mean, there is significant research out there, and I'll even just cite the CDC, that over the past 10 years, just think a 10-year period from roughly 2009 to 2019, students are reporting more issues with hopelessness, depression, anxiety, increased substance use in response to some of those mental health issues. And those increases over that 10-year period is up to 40 and 50% from 2009 to 2019. I've had the, pleasure and opportunity, I think some of the most rewarding work that I've engaged in Springfield is working with Beth Dixon and Ashley Mack with the Mental Health Recovery Board on research that's grounded in asking youth, what are the most pressing issues that they see, and they are referencing anxiety and depression.
Right.
So we had an opportunity to go through our middle schools and high schools and do focus groups and really get down to why they believe depression and anxiety are significant health issues. So I'm seeing it. I'm seeing it every day. And there's a multitude of reasons that I could cite, but yeah, I would say mental health for sure.
Okay. Well, let's take a look at the poll responses real quick and see. What does the audience think? And while I see they're small. There we go. It looks like most people agreed with you, Beth. Well, about 50%, I think it's 50% actually, it's the third highest percentage. Number 2, 55% answered number 2, 11 to 30%. And the last one, 59% mental health. Yeah. I'd have to agree. I mean, we have other issues, but definitely I would have to agree. Dr. Johnson, is there anything else you want to add, just talking about Springfield City Schools and the temperature and where we are with things?
Just piggybacking off of that, it's interesting that 59% of their respondees cited mental health as being the most pressing issue. I know Springfield City Schools has made a concerted effort to increase our programming, to support not only our students and families, but our teachers and staff. We've increased the number of mental health therapists that we have throughout the district. I'm proud to say that when I first started working in Springfield, every elementary school did not have a guidance counselor. And now I can safely say that that is the case. Like, each school has a guidance counselor for every building. We have several counselors at the high school. We've partnered with agencies within the community like Osterland, Mental Health Services, and even certain agencies outside of the community, Rocking Horse as well, to help support some of these pressing mental health and social emotional needs that our students are presenting with.
Mm-hmm.
So it's never enough, and it's one of those things like we could always use more, but the district has really made a concerted effort. And even now through our, we're going through a strategic planning process, and we've identified as one of our top priorities the social emotional needs of not only our students and families, but our staff as well.
Okay, great, thank you. You had mentioned about the guidance counselors being in the elementary schools, and I tell you, when we met a couple of days ago, and Emily shared what it is that she's doing even before elementary school, I think that that's great. So Emily, can you talk a little bit about what you're doing and how you're trying to prepare preschoolers so that they can get to the next level?
Yes, thank you. So what we do with the mindfulness and movement program is basically in the preschools. It started out with the concern based on what we all experienced in our play groups because of the COVID-19 situation, is that during this very, very early time, this is when young children are starting to establish their parameters for what is socially acceptable. Mm-hmm. And so right now they're just not getting the exposure that they need to basically wire their brain for these social interactions. And so what we do with the mindfulness and movement program is at the preschool level, and this is, we're not just talking about 3 to 5, we have 2-year-olds in the program as well, talking to them about identifying emotions, talking to them about calming the mind down. And this is by use of guided breathing techniques, supported breathing techniques, like your hand breathing in and breathing out as you trace the hands, things that would be used typically in a therapy situation. Mm-hmm. Using movement of the body to try to create those connections that are required to be a socially functional individual, and again, give them that extra support because it's been so lacking in this past year.
Wow, that's pretty amazing.
Yeah, and the fun thing is that, kids learn through play. Honestly, adults learn through play.
Yes.
So, you have fun while you're doing it, and the teachers have fun. I have fun while we're doing it. So, it's great all around. It really, really is.
Yes, that's great. I have a 3-year-old niece, so I'm going to have to talk with you offline so that you can give me some of those. Or maybe I can just use that for myself. That's a great technique. It really is.
It's fantastic.
Too old, right?
We are never too old.
Yeah.
We have found out through science that no matter how old you are, the brain remains plastic. It can be changed. You can learn. You can do it all.
So that whole thing about teaching an old dog new tricks,
the old dogs can learn the new tricks.
Okay, sounds good. Sounds good. Thank you. Sherry, can you talk a little bit about some prevention programs that we have, how prevention groups decide what issues to work on? Just kind of talk us through that.
Well, the focus of prevention groups is to reduce risk factors and enhanced safety factors or protective factors. And as Dr. Johnson was saying about the mental health, so the mental health, if we don't get that working well together with the kids, then they are going to make risky behaviors or self-medicate, and that's leading to, you know, the substance abuse that we're seeing in our town. Peer support is very, very important. And I know Bats is going to be speaking soon, and we have a group called STARS. And it's just about the students get to decide what are their stressors and what's causing it. And so it's really important that students see that they're not alone and that there's ways to protect yourself and ways to avoid, you know, risky behavior situations by learning ways to say no and being a more positive youth. So.
Who leads prevention groups? Is it all team? I'm assuming there's some adults there that.
Yeah, that's a great question. So Beth, I think, is the ally for the city schools for the Bats. I am for our STARS at Shawnee. But if there are any parents or students listening, you just find a trustworthy adult that can come in and you form a group, and the peer support it'll take its own course. And we have a very diverse group of students. Mine are 9th through 12th grade. And, you know, so they branch out into different projects based on what their passion is and where they think they can fit. It's also really a good thing because, you know, not everyone's an athlete, not everyone's getting straight A's. And so it's a place where everyone can feel they have a voice.
Sherry, can you talk about maybe one or two of the projects that the groups have taken on?
Right now we're working on a mental health piece, and we're doing some suicide prevention, You Matter kind of, you know, and believe in yourself, that support. So they've done things like where we have theme days, where, like, you know, top 10 Tuesdays, where everybody writes down things that, you know, are important to them, and, you know, just on different, like, top 10 movies. And so you can see where you get along, you know, coordinate. Gosh, last year we did several things. We do a lot for mindfulness and yoga and meditation, and we made stress balls. This year we're trying to find a way. I need to find a way, if anyone knows, to buy cheap little tiny rakes, because we want to make our own Zen gardens for everybody, because they love the Zen garden. So I'm looking for those materials. So it's just whatever they feel. And then you know, fidget toys, everyone, you know, need those
Right.
every day.
I need one too.
I know. I'm clicking my pen as we're sitting here. So yeah, so they come up with it, and like we do, like in October is Red Ribbon Week, and we're also going to, you know, that's our homecoming, so we'll do safe driving and safe choices, you know, and, you know, to have fun without, you know, substances.
Okay, great. I want to kind of go back. I got another question that was directed to me. Are there ways that we can support teachers and other school staff who have extra pressure dealing with COVID? How do we support them?
I think communicating is a big key. Being understanding that we are just trying to do what's in the best interest of the kids. We want them in class, we want them learning, but we also have a pandemic. So we are doing the very best we can with the situation that we're giving. And we just want each child to succeed. We want all the teachers to succeed. So I think being in communication as much as possible with your staff and teachers or whoever in the building, and having that open dialogue back and forth helps tremendously. And just being understanding that the bigger picture is that we want to stay open and we want our people to be as safe as possible. And that's our overall goal.
Okay. Is anyone else? Dr. Johnson?
I think piggybacking off of what Ashley said, this is a collective experience, right? You know, we'd almost say we're actually all experiencing this collective trauma of COVID-19 and this pandemic. So through that collective shared experience, I just think, like Ashley said, extending empathy, grace, seeking to understand. You know, I'm a big believer in providing a space for teachers to be able to express some of their concerns, express some of their thoughts and fears related to their return back to work, and trying to navigate educating our students at the same time maintaining safety protocols, which are important, vitally important. So again, I just reiterate the idea of, you know, this is a shared experience. We're all going through this together, and we all could stand to extend grace and empathy to one another in that regard. So
And I would just like to add too, and I think everyone has to remember it. You just sometimes need to push pause, put the core standards away for a minute or two, or, even one lesson. And, it's okay not to feel okay. But we're all, as I said, we're this together, but just breathe and pause and, we'll get through it.
Right. I would like for Monica and Brianna to answer that. I mean, as students and coming up on your senior year, correct? I mean, Lord willing,
I'm
we're
actually a
praying.
sophomore.
what-
She's a
what-
senior.
I'm a
though.
senior.
Okay, well, we're praying that, you're going to be able to march, 2020 didn't have that. So what advice, how could we support you and your teachers?
I think really it's just nice to have someone to be able to talk to. I know school can get very overwhelming, and you don't want to just feel like school is all you have, especially in your senior year. You want to have fun also and be able to be free and do those things. And it's just really hard to do that when there's so much pressure on you with COVID and your homework and those extracurricular classes and everything. It's just really a lot. So I think mostly what me as a senior would ask for is just someone to be there and be patient.
I would also like to say that like another thing that could keep us in schools is everybody wearing their masks. Like that's also very important because I see a lot of kids in the hallways who don't wear them correctly and stuff. And it's like, we want Brianna to be able to have the senior year she's dreamed of.
Say that one more time, Monica. The public service announcement.
Yeah.
That's great. That's good. That's good. Well, let's shift a little bit and talk about youth engagement and talk about, I'm so excited and looking forward to hearing from both Monica and Brianna, but I want to start with Beth just to kind of talk about BAPS and just kind of share what the program is and anything else that you want to let us know about BAPS.
Sure. Earlier, Nettie, the poll, the questions on the poll were, what percentage of youth do you think are engaged in, alcohol consumption and drug use? And, we as professionals, when we ask kids those questions, kids' perceptions are much higher. They think that everybody's doing it. They think everybody's drinking. They think everybody's doing drugs. And that misperception oftentimes affects the choices that kids make. I think people tuned in today to hear if the kids are all right. And I'm going to say they are. They care. Most of them are making the right choices. A majority of them are making the right choices. They're willing to work hard. They're smart. And they're working really hard right now to fix all the mistakes that we've made, messes that we've made. So I think I'm going to turn things over to Monica and Brianna because they've been working on an event. BATS is planning for October 2nd. It's called What's Wellness, and it's a day of wellness taught by you. So Monica and Brianna can tell you about the classes that they're going to be teaching, but it gives our community a chance to walk from session to session. They're going to have 9 different sessions. They chose the topics for the sessions because this is what they think kids need to hear.
Wow.
And our adults need to hear. So I'm going to just turn it over to them. This is going to happen October 2nd. You should be hearing a lot more about it.
How awesome is that?
Away.
Brianna, you want to go first?
Sure. So my session will be about nutrition, and I chose this because I am a runner. I do cross country, sometimes track. I thought this was important because not a lot of kids have a way to get all their energy out or take their mind off of things. And I feel like running really does that for you. And I feel like it's important to talk about how your health is important as well as nutrition also. And I think it's really good to be able to do something and be healthy and express yourself and not feel like it's the end of the world. I mean, oh, I only have one thing to do. So I think doing this will help others see that it's important to put yourself first and be healthy and eat the right things and do the right things for your body, stretch, yoga, all of that. So I think that's important. And that's what my session is. So hopefully you all can come and see me talk.
Tell us more. October 2nd, where's it going to be?
It will be
In various locations downtown.
Downtown, yes.
Oh, nice.
Yeah.
So you're going to make people get up and move.
Yeah,
Yes.
absolutely.
Good. Okay. All right.
Monica's a writer, so her session is about writing and how writing can help
Nice.
us. So Monica, do you want to talk about your session?
Of course. So I'm doing it with my friend Hala, and we are going to be doing it over bullet journaling. And this is kind of like a popular thing nowadays. It's like where you create your own journal. You can add like pretty colors on it. And I don't know about you guys, but I love it when things look pretty. It just makes me happy just to see like, oh, this day I was feeling terrible, but this other day was like one of my favorite days my entire life. And you can like reflect on that and be like, I've changed so much. I'm so proud of myself. And that's really what I want to be, talking about, is how proud we are of who we've become, really, honestly.
It's wonderful. What are the other 7 topics? Beth said there were 9, right?
Right.
What are the others?
We have a couple of, by the way, Monica's session is going to take place at Winans downtown.
Oh,
Brianna
okay.
is going to be teaching her session at Stella Blue. We're going to start the day with meditation, and we have our president of BATS, Noah Cheshire, will be teaching meditation on the top level of the parking garage.
Wow.
And then you can move on over and learn some Pilates over at the Madonna of the Trail Park. There's actually a goal session, and because we're concerned about social media, all of the BATS members have decided that we need to have a session just about social media. So we're going to ask the audience to just engage in a conversation and hear kids talk about social media and how it affects them. That'll happen at the Cohatch. So we'll have the event set up on Eventbrite really soon. And if you're interested in knowing more about that, you can definitely shoot me an email at the end of this presentation. There's going to be a list of contact information. We'll make sure you get a chance to register. It's all free. It's all taught by kids, their ideas. So, Monica and Brianna, do you have anything else you want to add about this? We have a lot of other projects going on. So I don't know, Monica, if you want to talk about the Zero Waste store, Brianna, the Choose Water.
Yeah, I would also just like to say that like at these events we're teaching, like things come with it. So like at my event, I'll have like journals and like supplies to make your own. Do you have
And at
anything?
my event, yes, you'll be able to leave with cooking utensils. So that's
Oh, great.
I feel like I'm doing an infomercial.
I
yeah.
tell you what, I tell you what, Joan, I'm ready to pass the baton because these 2 ladies right here, my goodness, our future looks so bright. The energy, and they're just so focused, and I just love it. I love it, love it, love it. So Monica and Brianna, I'm going to get with you, and maybe you can host the next Break for Health, because you guys are knocking it out of the box. You're killing it. You're killing it. You're doing a great job. And it's so informative. And I think that we as adults need to come and support and listen, but most importantly, learn.
Yes.
Yes.
Learn from you and listen. Absolutely.
Yeah.
That's great.
So Nettie, I just want to jump in because I'm sure you're seeing this too in the question and answer box. We're getting lots of wonderful comments.
Yes.
The resilience of these youth, all of the adults who are, there with them, beside them, behind them, supporting them. Just really thanks. This is just a wonderful opportunity for folks to hear about what's going on with our youth.
It is. The comments, you're right. And I was going to pop them up, and I'm almost out of time, but Catherine wrote, we need to acknowledge their resilience and helping them build on that. And that's part of this. We're going to start this. This is part of the foundation. And October 2nd will just be another brick that you lay on that foundation and continue to grow and build from it. Natalie said, this is phenomenal. And then Dawn said, no question, Monica and Brianna, you rock. And you're going to be the next moderator of Break. No, they didn't say that, but I did say that. How about that? Yeah, it's good stuff. It is good stuff. You know, Joan, we always do this, and it's almost like once we get in a roll and we start going, it's like the time is come that we need to kind of bring this to a close, and do our last poll. Thank people for coming. We've got a raffle. We're going to announce names, but I cannot thank this expert panel enough. You guys have been great. It's been a good conversation. And again, hopefully this continues to spark with people that have attended, and we'll just keep the conversation going. So let's go to the poll, to the last poll. Question 1, I plan to talk to my kids' parents about something I learned in today's session. I'm going to put my answer. Number 2, I know where to find positive activities to be involved with. Well, we all know the answer to that one because we just hit you with it. And the last one, I've learned the warning signs for kids who have some serious mental health problems. Boom. Submit. We're going to give everyone a few more seconds and then we'll reveal those results. I'm just looking at the chat to make sure I didn't miss anything. And there's the poll. Question number 1, 94% said yes. Question number 2, 100%. Look at that. You rock, ladies, you rock. And I was trying to find question 3, but it's gone. I didn't get a chance. Oh, there it is right there. And number 3, 61% said yes. They learned the warning signs. And I'm sure we can probably put some resources out on Community Health Foundation's website that will also kind of share with people some of the warning signs. We've got our resources down there.
So what I'd like to do, if I can just jump in here, Alex, would you put up the slide that shows the contact information for our panelists? While we're looking at this and folks are just jotting down who they want to follow up with, Dr. Johnson, would you just say, are there things that adults, parents, family members should be aware of if they see a change in their children's behavior where they should reach out for help? Just give us, 2 or 3 items if you can narrow it down that much.
Yeah, I think if you definitely, like you said, Joan, if you notice a change in your child or student's behavior from previous functioning, I think it's very important if you can open those lines of communication. And if you find that something that's revealed that's more concerning, I mean, there's definitely resources even within the context of the school. I talked about your guidance counselor. I know I don't work in Shawnee High School, but Sherry Akers is awesome. In Springfield City Schools, we have counselors and mental health therapists. And just, even if it's not someone with a mental health background, if you have a relationship with a teacher or a trusted adult, they can all serve as resources to help you get the necessary help you need if you suspect there's some issues with your child as it relates to mental health. But again, I think, not engaging in activities that were previously engaged in or they found pleasurable. If you have a child who's typically outgoing and they become more withdrawn, or and we talked about sleeping habits. If you notice changes in sleeping habits and dietary habits that don't have sort of a medical basis for those are some of the things that come to mind immediately. If they're not engaging in things that they would typically engage in, like social media or connecting with friends, those are some things that could be warning signs and may require just further follow-up.
Great, thank you.
Can I add to that as well, being a guidance counselor? Now it's the time for interim. So if you see a sudden change in your child's grades or have over the past years, or their routines, who their friend base is, that also can show maybe they're starting substance use because they don't have the coping skills and things. So listen to their teachers, or email those teachers and ask, how is my child doing in school? Because we see a lot in the school setting that you may not at home, and vice versa. So we all need to be partners.
Perfect. Hey, so let's just go ahead and We have one slide that gives you access or tells you how to get access to community resources. And then I would love to announce, I have drawn 3 winners for today's raffle. And I'm just gonna go with Stephanie Petroskis from Rocking Horse is one. And Crystal Arthur, Lucky Crystal also from Rocking Horse, and Catherine Hitchcock from NAMI will all be receiving certificates from Lee's Famous Recipe. So go ahead, Alex, to the final slide. Want to give a special shout out to Lee's for providing those gift certificates, and I'll be in touch with you all to get those to you. We have our next Break for Health session scheduled for December the 8th. And at that session, that one, we're going to go back to our regular time at noon on Wednesday, December the 8th. And we're going to learn about diversity, equity, and inclusion as it impacts health and well-being. I think that's a very timely topic. So excited for that. You will receive a follow-up email from this session with a survey. And I would love to hear from all of you about suggestions for future sessions. We take those suggestions seriously, and I do my best to weave them into the sessions that we have ongoing. So thanks everybody for joining us. Community Health Foundation thanks you. Thank you to all of our panelists, and look forward to seeing you at a future session, and have a fantastic evening. So good. Bye-bye. Have a nice evening.
Yeah.
Thank you
Bye.
so much. Everyone can say bye.